Rizalt is prescribed for the treatment of a migraine attack with or without the presence of an aura. It cuts headaches short, but will not prevent attacks. Generic Maxalt is a cost-saving medication prescribed by medical physicians worldwide. Maxalt, also marketed as Rizalt, Rizaliv, rizatriptan. Rizalt uses generic Maxalt is prescribed for the treatment of a migraine attack with or without the presence of an aura, visual disturbances, usually sensations of halos or flickering lights, which precede an attack. It cuts headaches short, but will not prevent attacks. Rizatriptan should be used only for typical migraine headaches. It is not recommended for any other type of headache, or for unusual types of migraine such as hemiplegic or basilar migraine. How to use this drug is taken by mouth as directed for migraine attacks. Dosage is based on your medical condition and response. If no relief occurs after the first dose, consult your MD or pharmacist. Doses are generally separated by at least 2 hours. Side effects: get emergency medical help if you have any of these signs of an allergic reaction to Maxalt: hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Stop using generic Maxalt and call your doctor at once if you have a serious side effect such as feeling of pain or tightness in your jaw, neck, or throat, chest pain or heavy feeling, pain spreading to the arm or shoulder, nausea, sweating, general ill feeling, sudden numbness or weakness, especially on one side of the body, sudden severe headache, confusion, problems with vision, speech, or balance, sudden and severe stomach pain and bloody diarrhea, numbness or tingling and a pale or blue-colored appearance in your fingers or toes, or, if you are also taking an antidepressant, agitation, hallucinations, fever, fast heart rate, overactive reflexes, nausea, vomiting, diarrhea, loss of coordination, fainting. Rizalt precautions before taking rizatriptan: tell your doctor or pharmacist if you are allergic to it, or to other triptan migraine drugs, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist if you have risk factors for heart disease including high cholesterol level, high blood pressure, diabetes, smoking history, family history of heart disease or stroke, obesity. Caution is also recommended in women after menopause or after removal of the ovaries, and men over 40 years old because of an increased risk for undiagnosed heart disease. Before taking this medication, tell your doctor or pharmacist your medical history, especially of certain blood circulation disorders, for example, Raynaud's syndrome, heart or blood vessel disease, stroke, kidney disease, liver disease, intestinal disease. Limit alcohol intake, as it may aggravate drug side effects. Caution is advised when performing tasks requiring alertness, for example, driving, as this drug may cause drowsiness or dizziness. This medication should be used only when clearly needed during pregnancy. Discuss the risks and benefits with your doctor. It is not known whether this drug is excreted into breast milk. Consult your doctor before breastfeeding. Interactions: tell your doctor about all other medicines you use, especially propranolol, Indrail, Inopron, or an antidepressant such as citalopram, Celexa, Duloxetine, Cymbalta, Escitalopram, Lexapro, Fluoxetine, Prozac, Rapiflux, Seraphim, Selfimra, Symbyax, Fluvoxamine, Luvox, Paroxetine, Paxil, Paxva, Sertraline, Zoloft, Trazodone, Tazirol, Aleptro, Venlafaxine, Efexora, Orvilizidone, Vibrade. This list is not complete and other drugs may interact with generic Maxalt. Rizalt storage: store at room temperature between 59 and 86 degrees Fahrenheit, between 15 and 30 degrees Celsius, away from moisture and sunlight. Do not store in the bathroom. Keep away from children and pets.